Today we're going to take a look at a healthy mouth, healthy body. Interesting topic. And you're saying that once our mouths are healthy, it will lead to a healthier body.
Well, Denise, you must have heard the expression many times, the eyes are the windows to the soul.
Yes, I have.
And certainly in my line of work, we see the mouth as a window to the health of the body. As there are, it's indisputable that there's a tremendous amount of association of the most common ailments that we have from a medical point of view in terms of the health of our body and as to what's going on in our mouth. The number one killers collectively in the Western world are diabetes, stroke, heart attack. Now note, these worst killers, these are all silent killers, and diabetes, a stroke, and indeed a heart attack, for all intents and purposes, until the moment it actually happens, these are all entirely painless. Well, actually, it's got everything to do with teeth and gums, and the correlation between your gum health and diabetes, stroke, and heart attack is now no longer in dispute. If we don't eat anything, if we just exist, we are alive and we exist, our mouth is infested. I mean, it is rife with bacteria, naturally occurring bacteria, no less than 400 different species of bacteria. There are in excess of 360 million individual bacteria in your mouth of 400 different species. Now, the mouth is the single dirtiest part of the body, bar none. More bacteria in quantity and more bacteria in variety in the mouth than anywhere else.
And that's because it's there's moisture, there's heat, there's...
Exactly. If you want to grow bacteria, what do? You create shade, you create moisture, because a lot of bacteria are killed by light. So you have a dark, warm, wet environment, and of course you couple that with feeding that environment with carbohydrate. So if I didn't eat anything between 9 o'clock in the morning and 12 o'clock or 2 o'clock in the afternoon, my mouth will begin to develop this thin film, this thin sort of furry stuff on the surface of the teeth called plaque. Now, if I don't brush my teeth for the day, by tomorrow morning you run your tongue across your teeth, you will feel that what we call a biofilm. That's the initial stage of plaque buildup. That will begin to occur. You don't brush your teeth for 2 days, 3 days, 4 days. That gets thicker and thicker and thicker. The process that happens now is that the bacteria around the gum line begins to chomp away at the gums. Now, when they've eaten and when they've consumed, they will excrete, and they will excrete acids that will break down the gum and, of course, teeth. So it's acids that causes tooth decay, so you get dental decay. Now, it's acids and other chemicals that causes damage to the gums, and so gums break down. And now you get this condition called gingivitis. Well, bleeding gums is the very first sign, usually, of the onset of gum disease. It's not normal. It's not okay. It does happen very often, and it's not okay. You can't allow that to let slip. And as that begins to break down, it then eventually goes on to the next stage. It now begins to infect the bone surrounding your teeth. And at that stage, gingivitis becomes periodontal disease. Periodontal disease, advanced gingivitis, which has now not only damaged your gums, it has now begun to resorb the bone. The signs of this are mobile teeth, bleeding gums, puffy gums, and the tooth itself, because it's lost its support, it actually begins to drift. These are the cardinal signs of gum disease and periodontal disease. So now, people say, well, okay, well, that's all good and very well, but what's that got to do with my heart, and what's that got to do with diabetes? And, well, actually everything. Because the process that happens with heart attacks and arteries thickening, with another kind of plaque. We talk about plaques within arteries of the heart. It's not the same as a plaque in your mouth. You get these buildups. You get the hardening and thickening of the arteries, and you get restriction of blood flow in the heart, and ultimately this can lead to a heart attack. Now, why does that happen? It's because you're piping, because the tubes get clogged up. The tubes get clogged up, there's not enough blood flow. Water doesn't come through. Okay? Because you've got like lime scale around a pipe. That's exactly the same problem with heart attacks and strokes. Now, that process is identical in nature to what is happening to your gums going puffy by the same bacteria. And now guess what? When you do autopsies on people who've died of heart attacks and who've died of strokes, and we look at the bacteria in their arteries, and the same bacteria that have lined the walls of the blood vessels, they are the exact same bacteria associated with advanced periodontal disease. If one is related to the other, so if you improve one, do you improve the other? So what, if I brush my teeth, my diabetes gets better? Yes, it does. When I do an examination and I see somebody in their 40s and 50s, particularly in this part of the world, the Afro-Caribbean community are the most susceptible, along with the Asian Indians, to diabetes. It's a genetic thing. And I'm seeing an excessive amount of not just gum disease, but that terrible periodontal disease. The first question in my mind is, sir, ma'am, I'd really like you to check your blood sugar. If you've had a history of gum disease, it means that you've had a history of chronic infection in your mouth. That means you've had, for many years probably, bacteria flying around your body from your mouth because you haven't been taking care of things in your mouth, bacteria flying around your body and affecting every part of your body. And when it gets to the superhighway of the blood, it goes everywhere. And that's huge. That's a very, very big deal. So subsequently, I'm not saying that one causes the other, but they certainly, it's like the evil twins. You don't see one without the other. They're always going to see in pairs. I can confidently say that if somebody has had chronic gum disease for a prolonged period of time, you can be fairly sure that they are going to have be either predisposed to diabetes. They're going to have thickening of their arteries. They're going to have thickening of the arteries within the heart and in and around the brain. That's really is basically undisputed now.
Now, how does improving one improve the other?
Mm-hmm. Well, the presence of bacteria is there on a daily basis. The thing about bacteria, you must remember, it's alive and multiplying as we speak right now. Between now and lunchtime, the bacteria has increased. And it continues to do so for as long as the bacteria is not removed. So you have this constant supply of, technically, this poison that's going into your blood, this slow sort of intoxication. Now, if we stop the sore, your body will remove the bacteria that flows into the system. Then obviously we will stop that association. I'm not saying by any means, and I want to be clear on this, that I will cure your diabetes by cleaning your teeth, but I will certainly lessen the effects of it. That correlation is clear. In the same way, if your diabetes is under control, you absolutely will get an improvement in your gum condition.
I have a question via text message.
Sure.
How dangerous, then, is kissing, given the exchange of bacteria involved?
How dangerous is kissing? So, in other words, is it transmissible? Now, I don't want to alarm people by saying that it is indeed an infectious disease. It is a certain type of bacteria. It's not much of the bacteria occurs naturally in the mouth, but the particularly nasty ones that cause the massive amount of bone loss and loose teeth and the bacterial invasion, and indeed dental decay, it is indeed transmitted, and it typically is transmitted first from mother to child, and it's almost impossible to avoid that. Kissing would certainly spread it, but the point is, it's very likely that those bacteria are already present in various numbers throughout the population. If gum disease and dental decay is a bug, then how about we get a vaccine and we eliminate the bug? Well, that's been on the cards for the longest time, but then the thing about gum disease and dental decay is it's completely self-inflicted. You can choose not to have any gum disease. You can choose not to have any dental decay. The next step that we have to get into, of course, is how we're going to prevent gum disease and how from it happening in the first place. And, of course, then how do we treat it if you have it? If you have gum disease, you get these little what's called periodontal pockets around the teeth. Mm-hmm. Now, let's imagine. Now, typically we call a periodontal pocket. It gets to be a problem when it's deeper than 3 millimeters. Now, that's very common, by the way. Now, let's say we have a 3 millimeter pocket around each tooth. And let's say in a typical adult you have 28 teeth. So 3 millimeter pocket around each tooth, full circumference of the tooth, 8 teeth, that will translate, if that is infected with periodontal disease, that will translate into an area the size of your palm of chronic infection that is there every day. In our mouths, because we're not always aware, we go around every day with an area almost the size of our palm with chronic periodontal disease. And of course that's going to have an effect. You are sick. You don't feel it. You're not in pain. That's why these crucial diseases are indeed the silent killers. And the bleeding gums is the first sign. When your gums bleed, that is an indication to you that that is where you need to brush the most.
Now, you wanted to talk about immunity.
Yeah. The immunity is like I said, it's like our internal army. Like we have an invasion, we have a bacterial invasion, like through gum disease. If you haven't been cleaning, if you haven't had your teeth cleaned by a hygienist or your dentist, and you're not going for your checkups, you can get this invasion into your body. The body now suddenly reacts. We have what's called the inflammatory reaction. So the blood vessels the blood vessels expand, more blood comes to the site, brings the white blood cells, and starts beating up the bugs that have invaded our body. Children have incredibly high immunity. They're born with a very high level of immunity. They basically get that through breast milk. And so very high level of immunity right from the very beginning. And that depletes somewhat as the child grows up into teenager, adolescent, and whatnot. And then when you get to my age, and that's only 22, by the way.
Yes,
no, when you get to about mid-40s, that immunity, which has now plateaued in about your your late 20s, 30s, the immunity, the ability, the strength of your internal army, right, depletes. What happens then is, if the ability to fight the bugs depletes, that means gum disease that you've been saying, okay, well, I've had reasonably healthy teeth, I've had a few fillings, and maybe I've had a tooth taken out a few years ago, and I've been ticking along fine, and I don't really have bleeding gums. And then all of a sudden, it's like, wait a minute, what's going on here? Why are my gums bleeding? I'm not brushing my teeth any less. I'm not doing anything different. Well, you've gotten older. And that means, as a result, one of the many things that happens is your immunity drops. Therefore, all of a sudden, people are like, but doc, I've been seeing you for all this time, and all of a sudden, this is beginning to happen. What's going on? It doesn't make any sense at all. Why is it that I've been fine for all of these years, and then all of a sudden, what? You suddenly found something? What's going on here? Immunity is the issue. And as we get older, immunity goes. So therefore, at my age and above, your mid-40s and above, you want to start stepping up that game. You need to improve. To get the same result of dental and gum health, you need to have an increased effort to achieve the same good health that you have had. Our mouth is like a washing machine. I'm talking right now. My mouth is producing saliva. I'm pausing, I'm stopping, I'm swallowing saliva, and my mouth continues to produce saliva. Now I go to sleep. I stop talking. My tongue stops. My salivary glands stop producing. I don't produce the same saliva. Now the bug's like, hey, cool. We don't keep on getting swallowed anymore. We can hang out now in this rotten saliva. And we can reproduce. Let's have some fun. Let's make lots of babies. The bugs begin to multiply because they're not being moved around.
That's quite a visual there. I just had that visual.
And that's what happens at night. So you've heard the expression morning breath, right? If you don't brush your teeth after every meal, you want to at least rinse your mouth after every meal, you certainly, absolutely have to brush and clean your teeth every day. First in the morning, kill those bugs that have been partying all night, and at the end of the day, kill those bugs that have grown throughout the day and you supplying them with food throughout the day. What pregnancy does, you have your body's spinning with hormones. You have all sorts of hormones running around your body, and those specific hormones associated with pregnancy that are in your body can actually cause an exacerbation, an exaggeration of gum disease, although it is not technically gum disease. It doesn't damage bone, it doesn't rot your teeth, it's not a permanent damage of gum disease during pregnancy. It will be an excessive inflammation. It is called pregnancy gingivitis. And all you can do is keep on brushing and keep on cleaning. Unfortunately, it does not respond as well as in the gingivitis. The inflammation and the bleeding gums remains, but don't worry. That pregnancy gingivitis does not normally go on to periodontal disease unless you stop brushing your teeth.
And I have 2 text messages. One, how important is cleaning of the tongue? And 2, how often should you be changing your toothbrush?
The tongue, of course, has all the taste buds and it's very porous. And it is that way because the tongue wants to smear food in order to be able to taste it. As a result, it can gather a lot of stuff. And sometimes the papillae on the tongue can grow excessively. They can grow and they can gather bacteria. it could indeed be contributing to the bad breath. Change your toothbrush as soon as it begins to lose its form and shape.